Now why don't we go ahead and open up the floor for any questions that you may have, and come up to one of the two microphones and any question you may have for our panelists. Please tell us your name, where you're from, and your question, please.
Hi, my name is Amaya Kulkarni. I'm a cardiologist in the area, and I work for Mid-Atlantic Permanente Medical Group here. So I have a question about how we talk about diversity and inclusion. And one of the things that I find challenging about the conversations around diversity and inclusion is that a lot of it's focused on what it means for the person included. And it's not just about that, right? Because it's about deepening the talent pool, right? There is an advantage to the group that is being joined as well. You know, the example I always give is the Red Sox lost World Series, didn't win a World Series for over 80 years because they didn't take black players at a time when most other teams did. So it's about deepening the talent pool. So I guess my question to you is, what do you say to the people who are being joined about the advantages to them of diversity and inclusion?
Thank you.
I'll jump in real quick. One of the challenges I think we have is that especially in North America, we tend to think of diversity as compliance. 6 of those, 7 of those, 10 of those. That's compliance. Yes, we may need it, but that's the foundation. And what I have found to be much more effective in my work with my clients is to help them understand that having diversity is about getting diversity of thought. You make better decisions, you make fewer mistakes, you have an overall better work environment when you have that diversity and it's respected and valued. So the first step is to get a whole different reframing of what diversity means in the first place. So those people that are already there see a benefit to having a diverse workforce or diverse team, et cetera.
I just want to jump in. This is thinking about your question. I was challenged with a very similar question as a chief diversity officer, making the business case for diversity. And there's a lot of resources out there. There's a McKinsey report, I think it's 2017, where they basically surveyed or looked at the board of directors, CEO, and all of the people at the VP or the C-suite level in industries in Latin America, Canada, the U.S., and in the U.K. And they go through all the benefits of diversity in terms of client, and also it goes to the bottom dollar in terms of making money. But here's the challenge. So I know as a chief diversity officer that in speaking to different groups that the message of diversity and inclusion will resonate differently. And so I have to be able to speak multiple languages, but also from the social justice perspective, this is where I was challenged in that diversity and inclusion is the right thing to do because it's just the right thing to do. And so what was the challenge someone said to me is, why do I always have to make the other case for diversity? Because it's simply the right thing to do. It's the moral imperative, it's the social justice imperative. As my colleague here stated, the centennials, not the millennials, the centennials who are the 8-year-olds who are going to make all the decisions about you and me and our future, they expect diversity and inclusion. Even to a degree now the millennials are talking about this is just expected. That's their business case for diversity. It's it's the right thing to do. And when it comes to issues of compliance, they're like, I don't care about the rules. I don't care. Let's break the rules. I don't care about the rules. Let's break the rules. As long as I have diversity and inclusion, which is intersectionality, very inclusive, I don't care if the rules apply or not. So I just challenge all of us to think about diversity and inclusion, not only from our framework, generational framework, but also from why we have to make a business case. Why can't it just be the right thing to do? And I'm not saying we shouldn't, but it's something to think about.
Well, if I can just, I'm sorry, I know that there's lots of other questions, but if I can just challenge one part of that. In convincing people who are not yet convinced of the value of diversity in education, part of it is taking off the sort of the biases that we bring in about what the right thing to do is, trying to understand their perspective and bring them to us. It's not necessarily about what the right and the wrong thing to do is. It's about convincing others of our viewpoint. And I think that from that perspective, there's value in understanding and helping people understand what's in it for them, because there is something in it for them. And we can't forget that there is value to people who are being joined. And I think that convincing them of that or engaging them in that conversation is probably a step forward.
I don't disagree with you. That's not what the person I think was challenging me on.
I see.
Challenging me. Because remember, I started the conversation with the comment that I make the business case for diversity, and
right.
It's very important to me. But why I was challenged was, why do I have to go there when you start thinking about, and this was a millennial, actually, who said this to me, they're just kind of like, I don't care about the business case. The business case it's a social justice prerogative, and whether you like it or not. And so I get what you're saying, but for me, I just want us to think a little bit broadly in terms of how different generations view diversity, and it's not necessarily from the business, making a business case like we are used to making a business case.
Thank you.
And I'll just add, from being a CDO myself, that, again, it's this whole notion about interest convergence. One of the things we do as CDOs is we translate. We translate what the D&I common principles and core principles that we're true to, and it's the right thing, but we need to also, as you say, we need to basically figure out where the other is, to basically begin that dialogue to begin with, to have that conversation, but also understand what keeps them up at night. And I think the beauty of good CDO officers can understand that, don't lose sight of the core principles of what we're trying to do, but again, can bring enough robust information to inform others about how diversity and inclusion can also be translated into what they worry about in their work and of every day as well. So thank you for your question. Dr. Carey.
Acosta and I were in residency together. I haven't seen him since then.
So she really doesn't have a question.
He stayed natural, and I dye my hair. He was a year behind me, and much smarter, I assure you. My name is Margaret Carey, and I'm faculty at Georgetown, and I also have a company called the Carey Group Global. And I want to ask the panel members, my passion is providing credentialed coaches to medical students, and it has made all the difference in the world. If you go to the Future of Coaching, which is a magazine this time I did, you'll see a lot of their essays about what coaching has meant to them. So we created a program called A Whole New Doctor. We provide free credentialed coaches to medical students. What I want to know is, we feel like we're out on the lone prairie. What I want to know is, where else are they doing that? And I'm not talking mentors, I'm not talking consultants, I'm talking credentialed coaches.
We are not doing that. I think that is great. We've been trying to figure out ways that we can do that, because like we heard this morning, you can't just say, oh, well, be a mentor, because people don't know what that means. And it actually is a full-time job, right? To know how to be a good mentor and to create that organic relationship.
Mentor's different from coaching.
Right. No, that's what I'm saying. That's what we do. That's all we do right now, is we tell people to be mentors, which is not even the tip of the iceberg. What we need is what you're describing. So I think that it's a full-time job, and I think it's a great idea. I would love to be able to take that to my team.
And I'm not sure that many places, I think that you're very innovative, and it will be great to see any evidence or evidence-based practices that come out of that. I will say to my colleague here that there's a lot out there in terms of mentor guidelines. There are a lot of, I know the University of California, San Francisco, I think College of Medicine has some mentor guidelines that are out there. So there's a lot now that's going on in terms of providing structure and helping students also understand and helping us understand the difference between having a mentor and also having a sponsor. But there's not a lot out there in terms of coaching.
So Maggie, I would also point you to Bruce Bromberg, who is from Kaiser Permanente, the Northern California piece. A couple of years ago, he did a session about GME. They have used, again, certified coaches for GME. What spurred it on for them was, again, some events of unprofessional behavior. But then they started realizing, with the successes that they were having with specific individualized certified coaches that came in to work with these individuals, and the outcomes they got from it, is now they started doing it across all the residency programs, looking at the value of that piece. So it'd be really interesting to get you two together, share what's that, or the continued work, so to speak, that you start where you are at and then move it on to GME to kind of continue the development of that piece as well.
Thanks. I'll send you an email with my hair. Thanks,
Will do.
everybody.
Thank you. This microphone here. Hi.
Good afternoon. My name is Marilyn Gerber. I am the co-prelude founder of NCAM and the Plaintree Medical Model. I'd like to address and answer is that I am a nurse, previously an engineer and a businesswoman. Nursing has developed some excellent evidence-based research models for nurse coaching that could be just switched on over to doctors. There's 3 organizations, the American Holistic Nursing Association. There is Bonnie Schraub, who is a psychologist in New York with her husband. And there is, I'm sorry her first name, but Luck, who is also, you'll find the website. I'd be happy to give you those coaching, fully certified. My only consideration, the price tag can be $3,000, $4,000. So my question about diversity. As you may know or may not know, in the civil rights movement, the #1 group of participants and warriors were Jewish women. My problem in nursing is that in ED, trauma, ICU, high levels of surgical nursing, you never see Black or Latino nurses. This population needs to be served, especially since 1/3 of the population will be Latino. So after fighting this, and if they come onto the units, they don't last long, they're harassed, they're bullied, they're pushed out, or if they even make it or hired into the ED, ER, surgical ICUs. My solution now is I am working with several key universities. There is more money in the world than ever in the history of mankind. We're going to create classes of all Latinos in Spanish and Black populations of nurses to serve their population and train them to train the next generation and the next group of nurses so they can go out and serve in their language and in their ethnic diverse background. Because it's not the way I see it, and I've worked in over 55 medical hospitals, clinics, ambulatory surgery centers. You never, hardly ever see Black nurses or Latinos. So this is not possible, will not necessarily meet the federal requirement of equal opportunity and diversity, but I see this as the only solution for these populations to be served. Is to educate them. And a language that they speak, and many of their population does not speak English, and it's going to work. Thank you.
Great, thank you for your statement. Due to our time, this will probably be our last question, so we don't run over. Please.
This is, my name is John Colkin, physician, artist, a couple other things. But what I wanted to bring out was a lot of the conversation has been around particularly university settings and students, where in reality, percentage-wise, the vast majority of clinicians are out in private practice settings. So a lot of the strategies that we're talking about may be effective in a university setting, but may not be as effective or as easily implemented in other settings. Back to what the previous question was about relative to how to coach individuals. I'm thinking about the Duke Integrative Medicine Health Coach Program. There are a number of excellent programs around the country where health coaches are being taught and certified and able to go out into the community and into some other settings besides just universities, where they're a potential excellent resource for getting someone who's actually trained to help physicians or other clinicians. So I just want to throw that out as another possibility, since there are already thousands of health coaches that have been well trained through integrative medicine programs around the country.
Great. Thank you for that. Thank you. So with that, please join me in thanking our panelists for an excellent presentation today.